This patient came to see me in 2016 for consultation regarding tooth number 14. The root canal was done about 2.5 months prior at Western Dental by a general dentist. And as you can see, there's a periapical relucency there. Short fill, which again means nothing if patient didn't have symptoms and there wasn't a periapical relucency and a missed MB2 there. But patient says after the root canal, tooth continued to bother her. She went and saw her dentist and was eventually referred to me. There's a crown on the tooth as well, as you can see. So the dentist did the root canal and then put the crown on. But patient continued to have symptoms. Again, you can see a periapical relucency there and a missed MB2. These were plastic thermofill obturators. And here's the date. As you can see, she came to see me in 2016, so 7 years ago, when I first saw her for a consultation. So we went ahead and talked about options, and she decided that she wanted to go ahead and try to see if tooth could be saved by redoing the root canal. So that's what we did. We went ahead in 2016. I did selective endodontic retreatment, which means I didn't mess with the palatal and the stobucal canals. There was a plastic thermofill obturator that I removed from the MB1, located the MB2, and cleaned, instrumented, and reshaped MB1 and of course MB2, and completed the endodontic treatment in one appointment. Let me show you the final result in 2016. So this was the final result in 2016, immediately after we redid the root canal for her. Again, selective endodontic retreatment. We focused on MB1 and MB2 canals. Again, you can see that periapical relucency there. And here's the date, as you can see, 2016, so 7 years ago, when we redid this root canal selective endodontic retreatment in one appointment. This is about a few months after we had redone the root canal. And as you can see, patient received a dental implant there. And take a look here. That large periapical relucency had gotten much smaller just a few months after the endodontic retreatment. And you can see here's the date. So putting the radiographs next to each other, this is the first time I saw her for a consultation regarding tooth number 14. So this was 2016, and you can see right there. And this was 6 months after we had redone the root canal, and here's the date, as you can see. So zooming out, you can see that periapical relucency got much smaller 6 months post-op. You can see how large it is here. This is before we redid the root canal, and this is 6 months after we redid the root canal. You can see how much smaller it got. So we thought it worked. Patient was happy, I was happy, and we left it to that. Well, patient came back to see me for tooth number 14 just a few days ago, saying that the tooth started to hurt, and she went and saw her dentist, and her dentist put her on antibiotics and referred her to me. I was surprised because, as I shown you, we did a 6-month follow-up of the tooth, and seemed like the infection was healing. The infection was gone, and the bone was healing. But it looks like maybe the infection is back again. And as you can see, 2023, that was just a few days ago when she came back to see me. So this is 7 years after we had redone the root canal on her, and looks like we have that periapical relucency coming back. Patient had the same crown from 7 years ago, the same crown that I had access through. So we again went over options with the patient, redo the root canal, or she could choose to maybe do an apical or extract the tooth, and patient said, let's just go out and redo the root canal again and see what happens. So yesterday went through the same endo access that I had created 7 years prior, and this time I basically said, okay, I'm gonna do, as you can see, we're 7 years later and palatal canal is clean and distal buccal is clean. These were thermophil obturators, and 7 years ago I'd done just a selective endodontic retreatment on the mesial canals. Mesial canal MB1 located the Miss MB2 7 years ago, but removed the plastic thermophil obturator from MB1 canal 7 years ago. Anyways, decided this time I would just remove the plastic thermophil obturator from the palatal canal and distal buccal canal and just do a complete endodontic retreatment, and that's what we did. And these are what we pulled out of the distal buccal. That's the distal buccal, and that's the palatal plastic thermophil obturator. So we went ahead and redid the root canal again in one visit. When I opened the tooth up, there was coronal leakage. So very likely the dentist who went in to replace my temporary filling with a permanent filling after I had done the root canal 7 years ago hadn't used the rubber dam. So when I removed the composite buildup, there was fluid buildup under the buildup there. Anyway, so we decided that this time it would be best to just go ahead and redo the whole root canal instead of again focusing on the mesials, and that's what we did. And here's the post-op. So as you can see, MB1, MB2 re-instrumented and reshaped distal buccal and palatal. So I'll have the patient come back in a few months for a post-op check, and we'll see what the outcome is this time. But as you can see here, everything went beautifully. And by the way, this time I went ahead and placed a permanent build-up myself instead of referring the patient back to her dentist for her dentist to do it. I decided while I was working under a rubber dam and everything was isolated and nice and clean, I would just do the permanent build-up myself. So that's what we did. And this is another angulation of the post-op. And here's the date. As you can see, it was just yesterday. And this is another angulation of the post-op of the work that we did yesterday. To those who commented that the implant seems like it was placed too closely to the mesial root of tooth number 14 in the case that I just posted, it's just the angulation. It's just the angulation, the PA angulation. Let me show you a different angulation. There you go. That's a different angulation. You can see that the implant is fine. It's got plenty of bone between the implant and the mesial root of tooth number 14. So it was just the angulation, the PA angulation, that shows that the implant is too close. It's not, as you can see here.